Hello, I'm Kwong Nguyen. I'm a physical therapist for the Baptist Orthopedic Hospital, and today I'll be going over some things you want to know about after your spine surgery. So the first time you come up from surgery, you'll be laying in the bed, and the first time getting up with physical or occupational therapy, first thing you want to know about are your spinal precautions. So a couple of things your doctors want you to follow is you want to avoid any bending, any lifting more than 5 to 10 pounds, and any twisting. And that comes into play with any movement, and it begins immediately getting out of the bed. So the first thing you're going to do is you're going to bend your knees up before you get out of the bed. And you're going to make sure that your hips, or your knees, hips, and shoulders stay in alignment as you roll out of the bed. So as you reach this hand over for that side of the bed, you're going to keep your spine in a neutral alignment. Roll all the way over onto your side. And then once your legs come off the bed, you're going to use a little bit of your elbow and hand here to sit yourself up. So legs will come off and you're going to sit up. And that will be difficult for most of the patients who have lumbar surgery, sometimes neck surgery as well. But your physical therapist will help you here in the hospital. And if you need any help at home, your physical therapist or occupational therapist will educate your family on how to help you at home as well. Now, your doctor, depending on every physician and procedure, may require you to wear a brace, whether it's a back brace or a neck brace. Here in the hospital, it will either be provided to you before surgery, or if not, then a physical therapist will fit you here in the hospital. I'm going to grab a brace real quick. So if you have some type of a neck surgery, some doctors may require you to wear some type of a rigid collar, kind of like this Aspen collar here. And in order to fit it properly, most of you will already have it on before coming up from surgery. And if not, then a physical therapist or an occupational therapist will be sure that you fit it properly with it. So when you're taking on and off the neck brace, you want to be sure that you have a nice snug fit, that your chin rests snugly on top of this portion here. Now, if Mike had a longer or shorter neck, obviously that doesn't fit him because he can kind of say yes, right, Mike? So you will need some support there. In order to do so, most braces will have some type of an adjustment to where you can adjust the length of it to where it's snug, so that prevents you from doing any bending. And if it was too loose here, right, obviously you'll have a lot of gap there. And what you'll need to do is just tighten each strap and make sure you as the patient don't move your neck until you're nicely and secured. And that's how it should fit. Now where you're taking off the brace, OT will go over a little bit more when you're getting into the shower or dressing. Obviously you'll need to take the brace off. And OT will kind of go over how a shower collar fits. But in order to take it off, we like to use the clamshell method, just taking it off on one side. Will make it a lot easier to put it back on so you don't have to mess with it too much. Okay. Now obviously if you had a back surgery, you'll have a little bit of a different brace than this one. You'll be looking at some type of an LSO brace. Okay. Most of them work in the same way, where they will add a little bit of compression to your core and your back to give you a little bit of stability and at least some stability to help your back out. So most of the compression that you get should be from this big straps here. Some people will just kind of lazily put it like this, and then they will really pull on these straps. So you want most of your compression from the big straps here. And we like to call these the fine tuners to give you a little bit more compression as well. Does that feel okay, Mike?
Yes.
Okay. Very good. Now, when we're sitting at the edge of the bed here, if you don't mind me sitting here, Mike, you're going to need to scoot forward. And one thing that Mike's doing already is you're scooting forward one hip at a time. You want to make sure as you're scooting forward, you're going to move your shoulder and your hip simultaneously to prevent twisting as much as possible. One other thing you want to avoid, now Mike, if you can show them, some people will lift their whole body weight with their hands to scoot forward and back, and that's going to be lifting too much. Remember, one of your precautions is lifting more than 5 to 10 pounds, and most people will weigh more than 5 to 10 pounds, so make sure you scoot one hip at a time. Okay, whenever we get ready to walk, some people may require an assisted device. Here in the hospital, we usually get up with a walker after surgery just because there is side effects of anesthesia. But sometimes people won't need it. So obviously it's on a case-by-case basis, and if you need one, your physical and occupational therapist will definitely assess and recommend you have one, and if you don't need one, then you don't need one. So whenever we get ready to walk, we'll stand up, make sure to use your legs and minimize weight through your hands because you want to limit lifting with your hands. And then when you're ready to walk, just think of the walker like a shopping cart, and it should be for balance, and you should walk nice and normal. Okay, we're good.